Hi, this is Marquita Brown. Today's topic can result in a trigger. This is a very sensitive topic dealing with suicide. If you or a loved one have thoughts of suicide ideation or attempted suicide, please reach out for help by calling 911, going to a local hospital, talking to a friend, or by calling the National Suicide Prevention Hotline at 1-800-273-8255. Today's topic is African Americans and suicide. Suicide is defined as death caused by self-directed injurious behavior with intent to die as a result of the behavior. A suicide attempt is a non-fatal, self-directed, potentially injurious behavior with intent to die as a result of the behavior. A suicide attempt might not result in injury. Suicidal ideation refers to thinking about, considering, or planning suicide. From statistics done in both 2003 to 2007 and 2008 to 2012, the rate of African American children aged 5 to 11 years old has doubled that of their white counterparts. Suicides by hanging are by far the most common suicide method in children. The Centers for Disease Control reported that between 1999 and 2004, young African American males had the highest rate of suicide. This latter finding is consistent with research that males are more likely to complete suicides, whereas females are more likely to attempt suicide. In 2012, 2,357 African Americans completed suicide in the U.S. Of these, 1,908 or 80.95% were males with a rate of 9.23 per 100,000 persons. The suicide rate for females was 1.99 per 100,000 persons. The overall rate was 5.46 per 100,000 persons. Males accounted for 89.1% of African American elderly aged 65 and older who committed or completed suicide, whereas males accounted for 83.8% of Caucasian elderly suicides. It is also important to note that generally there tends to be an underreporting of this behavior, so the numbers may be higher than those cited. Others have wondered whether African American suicides may be disguised in the form of victim-precipitated homicides. Victim-precipitated homicide is viewed essentially as an act of suicide because the victim intentionally engages in behavior in a life-threatening context that almost guarantees that another person, such as the police, will kill the victim. Although it has been estimated that nearly 30% of urban homicides are victim-precipitated, it is not formally recognized as a form of suicide. So why do people commit suicide? At the heart of the suicidal behavior is a strong desire to be free from suffering, whether that be emotional, mental, and/or physical pain. Some of these risk factors include being male, elderly, having chronic pain, substance use and abuse, chronic illness, lack of social support, poor response or an unwillingness to engage in mental health treatment, having a friend or family member that committed suicide, or members of the armed forces who have had multiple deployments within a short time span. If a friend or loved one has threatened to harm themselves, do not take the assumption that they are simply seeking attention. In many cases of suicide, the victim made it known to others that they were thinking about ending their lives. Additional warning signs include feelings of worthlessness, no hope for the future, giving away prized possessions, withdrawing from others, impulsive behaviors, feeling trapped, and significant changes in mood. If any of these are present in you or a loved one, please contact the National Suicide Prevention Line at 1-800-273-8255. For more information on this topic, you may contact the National Institutes of Health, blackdoctor.org, American Association of Suicidology, or the Suicide Prevention Resource Center. This has been your Apple for the day. Click, like, love, share, follow on Facebook, Instagram, and YouTube at Apple for the Day.